evening, friends. আমার নাম Dr. Nikhil Sonthalia. I am a senior consultant gastroenterologist and interventional endoscopist attached to Institute of Gastrosciences, Apollo Multispeciality Hospital, Kolkata and Apollo Clinic Jessore Road. আমি আজকে খুব কমন ডিজিজ known as Peptic ulcer disease সম্বন্ধে আপনাদের সঙ্গে কথা বলবো। Peptic ulcer disease is nothing but open sores that develop in your intestine, in your lining of your upper digestive tract, mostly in the stomach and upper part of your small intestine, which we call duodenum. এই জিনিসটা হয় আমাদের protective lining of stomach or intestine break হওয়ার জন্য। এটা কেন হয়? Most common cause is H. pylori infection. Second common cause is indiscriminate use of painkillers, which we call non-steroidal anti-inflammatory drugs. H. pylori infection একরকমের ব্যাকটেরিয়া যেটা আমাদের person to person spread হয় through contamination of stool or saliva in an unhygienic environment. Inflammatory drugs যেটা আমরা painkiller commonly over the counter নিই, that also can cause this kind of ulcers. Apart from this, too much of stress, too much of spicy food, too much of smoking, excessive alcohol can contribute to exaggeration of these ulcers. Common symptoms যেটা peptic ulcer এ আমাদের দেখা যায় is pain. Pain generally upper na middle part of your abdomen which is a yawning type of a pain যেটা খালি পেটে বেশি হয় আবার খাওয়ার পর or একটা অ্যান্টাসিড খাওয়ার পর কমে যায় but এটা আবার ফিরে আসে রাত্রিবেলাও অনেকবার পেশেন্ট পেন দিয়ে বসে পড়ে। Apart from pain, other symptoms that can happen is bloating sensation, fullness, nauseating sensation, feeling of faintness and sometimes dizziness. Apart from these common symptoms, যেটা alarm symptoms or worrisome symptoms যেটা দেখে আমাদেরকে একটু চিন্তা ভাবনা করতে হবে includes if you start vomiting and you see blood in your vomit or you pass dark black color stool যেটাকে আমরা মালিনা বলি or আপনারা পেশেন্টের সিভিয়ার ওয়েট লস হচ্ছে কিছু খেতে পাচ্ছেন না abdomen distension হচ্ছে then that means it has become a complicated peptic ulcer disease. এটা ডায়াগনোসিস আমরা কিভাবে করি? Most important is history. You have to visit a gastroenterologist based on your clinical signs, symptoms and history. We make a probable diagnosis. To confirm this and to identify a probable cause and to see how bad is the ulcer, we do a test which we call upper GI endoscopy. So endoscopy is a very simple, quick OPD basis test by which a thin lighted tube with a tiny camera attached to it is inserted after the throat into your upper part of your GI tract, which includes stomach and duodenum. So এই প্রসিজারটা দুভাবে করা যায়। একটা হচ্ছে under local anesthesia using a lignocaine spray or using a complete anesthesia in a hospital setting. This procedure takes hardly around 4 to 5 minutes, by which we inspect the lining of your intestine and stomach and esophagus and we identify the presence of this ulcer, and if required we take biopsies for H. pylori infection or any other cause that we may deem necessary. Endoscopy is an important test to diagnose this condition so that the treatment can be managed accordingly. Apart from endoscopy, other routine tests that are required includes blood test and ultrasonography to rule out other cause that are similar kind of pain korte pare. There are certain non-invasive tests যেটা দিয়ে আমরা H. pylori infection কে ধরতে পারি, namely urea breath test and stool for H. pylori antigen. Diagnosing this condition is very important because majority cases a simple medical therapy can cure this provided you also follow certain lifestyle changes. So do visit your gastroenterologist in case you notice any signs and symptoms above and get your peptic ulcer disease treated. Thank you.